Hi, this is Fred Barstein with 401k TV, bringing you my vlog. Today I want to talk about end of year, beginning of year tasks. We're coming to that time of the year. And one of the things you should be focused on is benchmarking fees for your major provider. So talk a little bit about why you need to do it, who you should be benchmarking, when you should be doing it, how often, benchmarking versus your RFP process, and the help that you should be relying on for these different processes. So the first thing is, why are you benchmarking fees in your 401k or your 403b for your providers? And the answer is, when you're spending other people's money, when it's the participant assets, then you have to be especially careful about documenting and benchmarking and doing RFPs. You should probably do it for yourself anyway if you are paying it directly, but if you are paying the record keeper and the advisor directly, it wouldn't be a legal obligation under ERISA. And that's the second reason. Under ERISA, and also with all the lawsuits, one of the requirements are that the fees have to be reasonable. And that really comes from a combination of benchmarking and going to market with a request for proposal. So who are the main providers you're looking at? Investment providers, for sure. That should be done quarterly. And we're going to talk a little bit about that in a separate vlog, especially around target dates. But today we're going to focus on record keepers and your advisor. So in terms of when you should be benchmarking your record keeper, that should be annually. And benchmarking is really about just using averages and databases there. So every year you should be benchmarking the fees, but going to market, RFP, should be every 3 to 5 years, unless there's a substantial change to your plan. Maybe you had a merger, maybe there's a big change in the market, or if there's a big change with that particular record keeper, maybe they bought somebody, or maybe they've decided to exit the market. Certainly it's a good time to go and do an RFP. For advisors, you should be annually benchmarking their fees with a database, but going to RFP every 5 to 7 years is what we recommend. So the difference between benchmarking and RFP, think of it in the healthcare. Benchmarking is like going to the doctor and he says, well, people your age with your condition are usually feeling these effects, and this is the therapy that I would recommend, which maybe doesn't give you a lot of comfort. But an RFP is you're going to market, and in the healthcare analogy is you, based on your situation, these are what record keepers and advisors would charge for these services. So it's very specific, but it also is a lot more work. So that gets to the final point, is help, because you maybe are not in the best position to do all of this RFP work on your own. When it comes to record keeper, generally we see plan sponsors like you using their advisor to do that. That's really what they're good at, and it's one of the many services that advisors can help you with. The challenge comes when it comes to going to RFP for your advisor. Should you be using your advisor to run that process? Maybe there's some bias there. Should you use a third party? There are a couple of them out there like InHub, or maybe using an accounting firm, a legal firm, or a TPA, or should you be doing it yourself? I mean, those are difficult questions, but things you should be addressing now, especially when it comes to the end of the year or the beginning of the year. It doesn't have to be at this time, but it's a good time to think about it. So thanks for watching my vlog. This is Fred Barstein signing off, and stay tuned for my next one.